according to this review on vitamin D, published in 2004. Until proven otherwise, the balance of the research clearly indicates that oral supplementation in the range of 1,000 international units per day for infants, 2,000 international units per day for children, and 4,000 international units per day for adults, is safe and reasonable to meet physiologic requirements, to promote optimal health, and to reduce the risk of several serious diseases. Safety and effectiveness of supplementation are assured by periodic monitoring of serum 25-hydroxyvitamin D3 and serum calcium.
Vitamin D insufficiency may account for almost 9 of 10 COVID-19 deaths, according to this publication in November 2020. Again, vitamin D insufficiency may account for almost 9 of 10 COVID-19 deaths.
So one of the ways I've described it recently is to say that with vitamin D, what's important isn't how much you take, but rather how much you make. And so when we want to measure that, we then of course have to look at laboratory testing. So let's look at measuring serum 25-hydroxyvitamin D3 in adults. The depletion level, where a lot of Europeans are, for example, is what I call depletion at less than 20 nanograms per milliliter, which with some laboratories is written as 50 nanomoles per liter. So again, depletion of vitamin D is anything less than 20 nanograms per milliliter or less than 50 nanomoles per liter. Vitamin D insufficiency, which is not quite complete deficiency, but certainly not optimal, we call that insufficiency. That correlates with increased risk for respiratory infections and acute respiratory distress syndrome. That's anything less than 32 nanograms per milliliter or less than 80 nanomoles per liter. What I describe as marginal sufficiency associated with increased mortality is anything between 30 and 40 nanograms per milliliter or 75 to 100 nanomoles per liter. Getting better but still not quite optimal is what we call sufficiency. So this is more health and less depression and less infections and less inflammatory burden, we might say. So sufficiency, which is marginal sufficiency of vitamin D, is approximately 40 to 50 nanograms per milliliter or 100 to 125 nanomoles per liter. And I think these days most experts agree that the optimal physiologic range of 25-hydroxyvitamin D in adults starts at 50 nanograms per milliliter or 125 nanomoles per liter. So when you get your lab test done, most people want to be at the level, again, of what we consider to be optimal physiologic range. This is between 50 and 90 nanograms per milliliter, or also written as 125 to 225 nanomoles per liter. This quick summary has been provided by Dr. Alex Vasquez. You can follow my work at inflammationmastery.com and or healthythinking.substack.com. Thank you much, and I look forward to seeing you there.